As the healthcare leader of the Tri-Parish community and with its Mary Bird Perkins Cancer Center at the forefront of cancer research and treatment, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community. And welcome back to Your Health with Terrebonne General Medical Center. Let's introduce our guest tonight. And here he is, Dr. Channing Sanders, who's an obstetrician, gynecologist at Terrebonne General Medical Center. And October is Breast Cancer Awareness Month. Doc, welcome to the program.
Thank you, Martin.
Good to see you again.
Good to see you.
First of all, I guess breast cancer, how is it different from other cancers?
I think probably the main thing about breast cancer that is the big difference is that it's mainly isolated in women at this point. There are small incidences that men can get it, but predominantly it's in women. And then they've had a lot of research and stuff lately that's linked it to hormones related to that women have to take at certain points in their life or exposed to. So there's been a lot of talk about it on TV and stuff like that. There are mainly two types of breast cancer that we sort of encounter. One, which would be more of a ductal type cancer that mainly drains the breast tissue, and then one of them being a lobular type cancer. That's the actual glands that produce breast milk that sort of proliferate into a type of breast cancer also.
Who would be affected by breast cancer?
Well, like I said, the main people that are affected in general are women that, and there's a lot of different types of risk factors, that come into play with that. There's really about 4 of them that sort of are something that are out of our control, mainly having to do with the fact that it is women and it's their age associated with it. 50-year-old women are probably a lot more likely to get breast cancer than most other women. And as far as the age, like I said, women are probably about 100 more times likely to get it than men. The overall prevalence of breast cancer in women is about 12.6%. So
I guess my question, any difference in races, so to speak, or is it general?
No, it's pretty much across the board on that. Yeah, it doesn't really have a lot of factors that affect it as far as race. There's the main other things, I guess, otherwise that would sort of affect that would be family history, especially people that have had histories of having breast cancer, uterine cancer, ovarian cancer, or some type of colon cancer. If you have those histories and stuff, about 20 to 30% of women that have had that type of cancer are sort of exposed to an increased risk of breast cancer. There is some gene research that's been going on for a long time where they've been looking at these BRCA1 genes and 2 genes. They've been doing a lot of research on that and stuff and checking that. The only problem with that is there can be also some downfalls to doing that kind of research, because if you're found to have the gene, you have a much more likely chance of getting breast cancer. They estimate that 80% of women that have the BRCA1 gene or 2 gene have an increased risk of breast cancer, and then the insurance companies really don't like to hear about that a whole lot, and you really don't know what to do about it. You haven't detected it on them or anything yet. They're just at increased risk. And then probably the only other one would be there's a small risk having to do with menstrual history, which if they've either started having menses early in their life or they go into late menopause, it increases their risk somewhat. There's a couple other factors that you control, mainly as alcohol, obesity, and childbirth. We don't really advocate having kids early in life or having a lot of kids, but that actually does decrease your risk somewhat. They say that if you're over 30 years old and you have 1 child or less, you have 1 or none, your risk of breast cancer is actually increased.
Really?
Yeah.
I've never heard that. That's new information for sure. What are the potential symptoms if somebody is trying to recognize if they have it or not? What are the symptoms?
Well, unfortunately, one of the biggest problems with breast cancer is it really goes asymptomatic until you actually feel a lump. So You don't really usually experience pain or anything, but when it gets into the point where you feel a lump or it's in its advanced phase, you can start having some problems with the tissue of the breast, where you may notice some dimpling, some redness. There could be some discharge from the nipple, or some kind of symptom like that. Usually when you see that, you probably have got something that's so advanced it would have been detected by mammography much earlier than you have.
All right, what we're going to do, we'll take a short break. When we come back, a few more questions for the doc. It's all next. Don't go away. We will take a short break right now.
No matter their healthcare needs, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
All right, welcome back. We're talking with Dr. Channing Sanders, who once again is an obstetrician gynecologist. Don't say that real fast, 7 or 8 times in a row, at Terrebonne General Medical Center. We're talking about Breast Cancer Awareness Month. And by the way, the NFL has really got into
They certainly have.
awareness.
Yeah, just about everything they wear has some kind of pink.
Pink armbands, pink hats. But that's good.
It is.
They really help bring the cause. So
Yeah, I mean, you can see it pretty much anywhere you look, in the grocery stores, all over. I mean, they have it on potato chip bags. Everything you look at has some pink on it during the month of October.
Good marketing.
Yeah.
Good marketing. All right, let's talk about the tests that are recommended in order to catch breast cancer in the early stages. What would it be?
Okay, well, I sort of summarized some mammography stuff. I did a little bit of research just to sort of try and get some stuff clear about that, because there's been some stuff in the news about it lately that might confuse people. There's a United States Preventative Task Force that came out with a recent recommendation that mammograms should only be done every 2 years, and they don't even advocate self-breast exams. Which is way different than what's been done in the past.
Right.
The American Cancer Society does not advocate this. They recommend routine screening yearly, starting at 40 years. They still actually are sort of on the fence on the self-breast exams. The Mayo Clinic, which is another place that I looked at recently, sort of goes along with the American Cancer Society. But then when you get into the private sector and stuff, you got to realize that most of those places are academic institutions, and they do studies and they come out with recommendations. A lot of the private physicians and private sector will not follow those exact recommendations. The big deal about mammogram is they always say, well, you need to do more mammograms if you have some kind of family history or some problem in the breast. And, like I said, 1 in 8 women will have breast cancer or be exposed to some form of problem like breast cancer in their life. So most people are going to have some kind of family history or a problem where they may have fibrocystic disease, and they may end up having to do mammograms early. Some people start them at 35 yearly, because you start seeing breast cancer appearing before 40, but it's just rare. You don't see it quite as much.
What type of treatment and support does Mary Bird Perkins at TGMC offer?
Well, they pretty much have a comprehensive support group and set of doctors that treat just about any form of breast cancer. As you know, they're building a new Mary Bird Perkins Center in the front.
Right.
It's under
Beautiful
construction. It's hard to really see exactly what everything's going to be at this point, but they're going to pretty much offer comprehensive services, which would include mammograms, chemotherapy, radiation, surgery to remove breast cancer. And then they have certain support groups, and they're going to have a lot of teaching and counseling throughout the process of someone discovering that they have breast cancer and treating it.
I see Bosom Buddies. That's a support group, huh?
Yes, it is. Yeah,
that's pretty neat.
Yeah, they have a couple, and they have one of the big things that they're sort of looking at is they're going to have an early bird screening that comes up on October 23rd. It's going to be in the parking lot of the mall. And they're going to actually have a mobile unit there where a physician does a breast exam, and then they're going to have a mammogram actually able to be done. It's going to be free. which is good, you know, so some people can get exposed that may not have insurance or have some kind of coverage. And then they also have the outreach center involved in a lot of the stuff that they do with the Mary Bird Perkins and Terrebonne General, where you can actually call, make appointments, and get in for certain counseling groups and other stuff like that.
What's the survival rate for this type of cancer?
Well, the survival rate's pretty much like most cancers in general. Some cancers you get maybe sort of really bad, you know, but breast cancer in general, there's 4 stages, and the earlier the stage you find it in, the higher your survival rate could be. So if you're in a stage 1, your survival rate could be up to 100%, you know, because you're finding it real early, you're going to get it out. You may have to do chemo, maybe not. A lot of people don't nowadays, and that has a lot to do with estrogen receptors in the breast. If they're positive or negative, depends on whether you take tamoxifen or chemotherapy. So some people are actually getting breast cancer removed and not having to get any chemotherapy throughout the entire treatment.
Now, we've talked about Breast Cancer Awareness Month in the NFL. What are you all doing at Terrebonne General Medical Center? What's y'all program about?
Well, they have a lot of pink stuff going on for sure. The nurses are all wearing some pink ribbons. They have a certain area near the Women's Center that they designated the pink zone. There's a piano in there, and they've put some pink bows and stuff around it. They've been handing out pink lemonade, and they've changed the door, the little curtains that are on the doors to be pink. So, you know, they have a lot of stuff going on. I think they have a day coming up, I think it's actually the 22nd, that's National Mammography Day, where they're going to encourage all their employees to wear pink. You know, so it's all, pretty much everybody goes in line with that pink. It just seems to make people remember more that, you know, that's what it's all about this month.
It's all good. Dr. Sanders, thanks for joining us tonight.
Right.
We appreciate it.
Thank you, Martin. I appreciate
Nice information. Very nice.
All right.
All right, we're going to take a break. When we come back, Harry McCullough's in the kitchen with Canada's. Don't go away. It's all coming up shortly.